Rates of pertussis, commonly known as whooping cough, is on the rise in Minnesota. So far, there have been about 2,100 cases throughout the state, and that number is expected to rise. Lacey Monteleone spoke with one local healthcare official today about the disease and is now live in the studio with more. Lacey, what did you learn?
Well, Jamil, the Department of Health says the state of Minnesota is on track to exceed 3,400 cases this year. It would be the highest number of cases seen since the 1940s. And while Beltrami County has so far only seen a few cases, officials say the key to keeping that number low is prevention. At first, you may think it's just a common cough. But that characteristic sound of whooping cough does not set in for a couple of weeks.
They become so repetitive, the coughs, so they call them paroxysmal. They're just, really draining, very exhausting kind of cough.
And because the disease starts with cold-like symptoms, many adults may not even know they have it.
We're seeing increased disease rates in adolescents and adults. And they're having a milder disease, recovering, maybe not necessarily getting medical intervention or identification of that they have pertussis, so they're not getting the antibiotics to take care of it.
Dwyer says infants and young children are more at risk for the disease, and that has parents like Leanne Jacobson worried.
It is scary. It's kind of alarming. I guess they need to have some more awareness for parents, because obviously people aren't aware of how serious it can be.
Healthcare workers say one of the best ways to make sure children don't get the disease is to make sure adults remember to get their boosters.
Usually in the age of around 10 years old, we found that the immunity to pertussis from our childhood vaccines is dropping.
She says it's important for anyone over the age of 11 to make sure they've been vaccinated.
If you don't have great vaccination rates in that for that disease, yes, you will probably see an increase in the disease rate.
And for parents like Jacobson, spreading awareness is important in stopping the spread of the disease. Now, more than half of infants who get the disease are hospitalized. In severe cases, they can suffer from pneumonia or broken ribs. The Department of Health is urging any adults in contact with children, including pregnant women after 20 weeks, should talk to their doctor about the Tdap vaccine.
Thanks so much, Lacey. And pertussis cases are also rising nationwide. 18,000 cases have been reported so far this year, with 9 children dying from the disease.
If you've enjoyed this segment of Lakeland News, please consider making a tax-deductible contribution to Lakeland Public Television.